Hi, my name is Dr. Alexandra Lewery, and today I will be talking to you about speech recognition. What is speech recognition? How do we get that? And basically, what does it tell us? Speech recognition is basically like it sounds. It's our brain's ability to understand and recognize speech sounds. Now, anatomically speaking, the way that our hearing works is we have little nerves in our ear whose job is to process external sounds. Once the nerve picks up on the sound, it will then transmit it to the brain, and then the comprehension centers of the brain have to take all of those sounds and put them together to create clarity. And that is a very simplified version of how we're able to hear. When there is any kind of hearing loss or any kind of nerve damage, not only does the nerve deteriorate, but essentially, as a result of the nerve deterioration, the brain is not getting adequate stimulation of sound. And therefore, when you have this hearing loss for a certain amount of years, the brain is also not getting stimulation for the equivalent of that many years. And as a result, your speech ability and your speech recognition can also deteriorate. And that, in addition to the hearing loss, can cause speech clarity issues, misunderstanding, and overall miscommunications. So hearing will essentially occur in two parts. The nerve is important, but the brain's ability to understand sounds is important too. So part of the audiological battery, part of the hearing examination is a speech recognition portion where you are asked to repeat 25 words in each ear. Now, these 25 words that are provided are going to be research-based. So they are generally monosyllabic words, which means that they are comprised of one syllable, relatively easy words. And they are words that are very common to occur in our everyday speech, in our everyday environment. In these 25 words, the sounds that we use on a daily basis are encompassed in these words. So when we're doing this testing, we can get a very good sense and a very good idea of what your brain is able to recognize, what information is it able to put together, and on the contrary, what information is it unable to put together as a result of deterioration over time. Now, speech recognition ability is a very important measure that's part of the hearing examination and will give us an overall idea of how well and how successful you may be able to function with hearing aids and what kind of damage has occurred to the comprehension centers in your brain as a result of hearing loss over time.